5 on your health tonight. A new look at a painful skin reaction that only occurs when you eat certain foods or touch certain plants outside in the sun. Here to explain is Dr. Clarissa Yang, the chair of dermatology at Tufts Medical Center. Dr. Yang, thanks for joining us.
Hey, Dr. Yang, thank you. And would like to start with some pictures. We showed some earlier, but folks, if you're just tuning in, we want to warn you that they might be difficult to look at. So here come the pictures. It's a rash. It's a rash that can turn into blisters like this, and it's right around the mouth area. The mom who posted these photos, and allows us to use them, by the way, says her 7-month-old baby developed them after teething on a celery stalk for about 20 to 30 minutes in the sun. The condition is nicknamed margarita burn, but it's not caused by margarita. So, Dr. Yang, what causes it?
Yeah, so there are certain fruits and plants like celery that you just showed, citrus fruits, most commonly limes, hence the term margarita burn, where a lot of people who are juicing limes get this burn. So this chemical compound within these plants and fruits are called furocoumarins. And if the chemical gets on your skin and then you get exposure to sunlight, it'll create what we call a phototoxic reaction, which is basically a burn on the skin.
Wow.
And the reactions can be minimal, where people don't even notice it, but yeah, or it could be as bad as what you've shown.
Yeah, it looks so painful. So
Right.
we know that everyone's skin is different, but who's most at risk for serious symptoms?
So honestly, it's what everybody actually can get this reaction, but interestingly, people who have wet skin, so the drooling for the babies, people who are heavy sweaters will have a worse reaction.
So, Doctor, let's talk about solutions. Like you just said, perhaps some of them, don't feel much discomfort. But are these rashes easy to prevent? Are they easy to treat? And let me take it to another level. Can they cause scarring?
Yeah, so prevention is easy. So once you're done squeezing the limes, eating, make sure you're washing really well. Sun protection will obviously help. If you do get it, doing cool compresses, just like you would manage a sunburn, is helpful. Some pure aloe, calamine lotion, sometimes topical steroids. And then generally these rashes actually don't scar. They usually resolve over weeks to months. But if it's a bad enough reaction, it could scar.
Okay, something to keep in mind. Dr. Yang, thanks so much for joining us.
Thanks, Dr. Yang. Take care.